Good morning. Hello, hello, hello. Today is Wednesday. I am continuing the conversation about why your anti-inflammatory treatments are not working. Today, I am talking about ice and creams, anti-inflammatory creams. So before I get into those, I wanted to add another point that I forgot to talk about yesterday. So yesterday I talked about why your anti-inflammatory treatments aren't working, and I talked about ibuprofen. So I forgot to mention that when you take anti-inflammatory pills, NSAIDs like ibuprofen, and it's just enough to get rid of the pain, but it's not enough to wipe out the inflammation completely, it might not work well for you, and you'll always be chasing the problem. So remember, yesterday I talked about that the threshold to get rid of pain is low compared to the threshold to get rid of inflammation. So if you're taking ibuprofen and you're taking just enough to get rid of the pain, there's always going to be some inflammation there. So you're always going to be chasing it. You're always going to be reacting to the inflammation, and you're going to be stuck on those NSAIDs like ibuprofen forever. So what you can do instead, I mentioned yesterday, eating a diet that limits sugar and bad fats. If you do that, you can get rid of the inflammation that you have now, especially if you do it concurrent with taking NSAIDs that do work, talking to your doctor about what dosage can get rid of inflammation, and eating that diet that's low in sugar, no sugar, reduced bad fats, higher in the good fats. Then you can knock out the inflammation and prevent it from coming back. So then you can get off the inflammation. So that was just a quick point I wanted to talk about before we get into talking about ice and creams. So I've been telling the story about Melissa. Melissa had knee pain. Doctors couldn't decide, is it arthritis? Is it tendonitis? Is it a meniscus problem? What is it? And so she was using ice for a while. So ice works great for new acute injury causing inflammation. So Melissa had the knee injury from, let's say she had a knee injury from running. I don't actually remember what the full story is. I'm pretty sure it was running. Let's say she stepped wrong one day and twisted it. Nothing major, nothing too bad, but it did swell up a little bit and it was bothering her. So ice is perfect in this scenario. It's perfect in this time period. Her knee was probably a little swollen and warm. So when this happens, you want to cool it down. If it's warm, cool it down with ice. So Melissa does this every day for a week, and it helps. The knee isn't getting warm throughout the day anymore. She continues icing because historically it's felt good. It's made things feel better. After a few weeks, she notices that the ice doesn't do anything anymore. When her knee hurts, she ices it, yet her knee still hurts. Why did the ice stop working? So the ice stopped working because the inflammation isn't localized to the knee anymore. It's now systemic, whole body inflammation. The acute inflammation only lasts a week or two unless you keep re-injuring it. But if you don't keep re-injuring it, it gets out of that acute new phase. So putting ice on your knee for a systemic inflammation problem isn't going to do anything. It'd be like icing your elbow for knee pain. It'd be like icing your elbow when you bump your knee and cause a new acute inflammation in your knee. Well, icing your elbow is not going to do anything for your knee. Icing your knee isn't going to do anything for whole body systemic inflammation. You could take a whole body ice bath. Ooh, I don't actually recommend that because that's miserable. I've never done a whole body ice bath. I've done it for my hand, tolerable, doable, still not great. Really helps with the inflammation when it's at your whole hand or your whole foot, like an ankle sprain. But getting your whole body submerged in that ice just looks miserable to me. Granted, you only need to do 3 minutes, but I don't really recommend it. So there are other less miserable ways to alleviate the inflammation. But just like the cortisone that I talked about on Monday, the ice works for localized acute inflammation. If it's no longer inflammation in the knee and the inflammation is the whole body, icing the knee is not going to touch it. And so that's why if you're icing your knee, your back, and it's not doing anything anymore, well, it's because it's not getting to the origin. It's not getting to the source of the issue. If you have inflammation coursing throughout your whole body, unless you get rid of all that inflammation that's in your blood system and your lymphatic system, it's just going to keep cycling through. And then another point I want to talk about is creams, aspercreme, biofreeze, deep blue. Sometimes they work, sometimes they don't work. Why? I think these creams can be great. I particularly like them for muscle rubs after a walk, a run, a strength training workout. Deep blue is my favorite. One of my patients in the traditional PT clinic actually introduced me to it. I don't remember her name, but I do remember that she hated biofreeze, and that's what we kept in the clinic. And she said it just didn't work for her. So she asked if she could bring in her own deep blue and if I would use that on her back muscles at the end of a treatment session. And so I did, and she really liked it. And I asked her about it, and she said it was the only cream that worked for her. She didn't know why, but that was it. She had tried the aspercremes, she tried the biofreeze. And so then when I was training for my last half marathon in 2017, that's what I used after long runs. I used deep blue. I actually, and then a couple of years later, I think it was 2020, that I compared aspercreme, biofreeze, and deep blue after a workout. And deep blue, and I used them all in different parts of my leg after the same workout. And I really realized that the deep blue was the best. And I really like it for muscles, so sore muscles, but they don't always work. So why? So you guys might be noticing a common theme here, that if you're not hitting the origin of the problem, it's not going to work. So the cream only goes so deep, right? It only goes, skin deep, maybe a little bit lower. So if the pain and the inflammation are originating deeper than the cream can get, it's not going to work. And so it will give your skin the tingling and the cooling sensation, but it might not be going deep enough to actually get to the problem. That's why I like it as a muscle rub, because you can calm down the sore muscles, but I don't like it for joint pain because the joint pain is typically deeper or it's not localized, so the cream isn't going to touch it. Again, it's like rubbing, it's like the ice on your knee for a systemic problem. It's like icing your elbow for a knee problem. It's like putting the cream on your elbow for a knee problem. But I noticed that it just doesn't get deep enough in the joints to help out with joint pain there. I think it works great for muscles where you rub the cream into the muscle and help alleviate it. So that is today's video, talking about why ice might not be working for you, talking about why the creams aren't working for you. If it's not hitting the origin of the problem, of the symptoms, it's not going to touch it. So icing your knee for a systemic inflammation problem, not going to do anything. Putting cream on your knee might not be getting deep enough to hit the origin of the problem. Or if it's, again, the systemic, the whole body inflammation, putting it on your knee is not going to do anything. So that is it for today's video. I hope this was helpful. Let me know in the comments what you found interesting, and I will be back again tomorrow to talk more about why your anti-inflammatory treatments aren't working. Have a great rest of your day.